But first, information that could save your life. Information that desperate politicians prefer not to tell you. It's about those face masks that as of Wednesday will be compulsory in Victoria and who knows, maybe in New South Wales after that.
We are going to be wearing masks in Victoria and potentially in other parts of the country for a very long time.
Wearing a mask makes a practical difference, so just following people who wear masks and the settings in which masks are worn has shown that there's a really significant 2/3 or more reduction in transmission.
But how true is that really? Is this new law really coming in simply because the Victorian government is desperate to be seen to be doing something about this second wave of new infections that it created by totally mismanaging its quarantine hotels? What a disaster it created. Today, again, another 275 new infections. But the government can't afford to shut down the whole economy to fight it, and getting people to wear masks seems a much easier option. But how safe exactly is that option? And the way it's now sold, is that actually putting lives in danger? You see, this advice is a big change from what you were told until now. Until now, the Victorian government said no need for bans. In fact, the Federal Health Department's advice still says that wearing masks in the general community is not generally recommended, unless keeping physically distanced from everyone else is hard, say in a train or a bus. And the World Health Organization agrees. It says the widespread use of masks by healthy people in the community setting is not yet supported by high quality or direct scientific evidence. And there are potential benefits and harms to consider. Potential harms? Well, yes, indeed. Here is America's top coronavirus expert.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often, there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
Okay, so wearing a mask, if you're sick, it might stop you from splattering people with your, if you sneeze or something with your virus. But if you're healthy, if you fiddle with the mask, you could actually be bringing the virus exactly to where it needs to be, near your mouth and your nose. But that's not the only danger, and I'll get to what really is. Now, Victoria's Chief Health Officer says he actually changed his mind on masks from them being not needed to now compulsory or a $200 fine because of a survey in the Lancet Medical Journal this month. And it is true that this survey did say that face mask use could result in a large reduction in the risk of infection, with stronger associations with N95 or similar respirators compared with what you normally see, a disposable surgical mask or similar. Just for your information, an N95 mask looks like that. That's 50% better than a surgical mask, according to this study. Okay, so that sounds pretty conclusive, right? And that's why ABC staff, for instance, who are always seemingly on the side of big government, are right behind government now forcing you to wear these masks, with ABC presenter Michael Rowland tweeting that if you're in Melbourne and you refuse to wear a mask, you're no better than an anti-vaxxer. You just don't believe in science, apparently. You're a conspiracy nut. But like the ABC's absurd alarmism on global warming, this rah-rah for the masks is itself not based on science, well, not the complete science. Now, for a start, the author of this Lancet study that persuaded the Victorian government to change its minds themselves warned there haven't been good scientific trials of these masks, and they themselves have only a low certainty about how good they really are. In fact, the masks, even a face shield, they say don't afford complete protection from infection, and their optimum role might need risk assessment. Okay, so the risk of wearing them actually needs more study. So, what risks, you may well be wondering? Well, as it happens, 2 new studies are just out not yet peer-reviewed, that's true. 2 new studies talking exactly about these risks. And the main risk is this, that people wearing masks start to think, I'm safe. I can go out more. I don't need to be quite that paranoid. I don't need to be that strict about what really does work, which has been keeping your distance and washing your hands. Okay? Now, one of the studies from Yale University compared the behaviour of people in American states which insisted on masks with people in states that did not. Much like we see in New South Wales, they don't insist on the mask yet. And the study said that people with masks tended to go out more often to places like restaurants. And this was a real danger. It said, we find face mask mandates, demands that you wear them, lead people to spend 20 to 30 minutes less time at home per day and increase trip taking to a variety of locations, chief among them restaurants. And it said such substitution behaviour, going out more, could be the difference between controlling the epidemic and a resurgence of cases. So there you have it. These researchers said masks could actually make it harder to control the virus because of the effects they had on human behaviour. And in Australia, another survey from Bond University says to insist on face masks in crowded places, indoors, high risk, yes, do that, insist on them in places where you can't keep your distance. Because there are actually, it says, insufficient data to quantify all the adverse effects that might reduce the effectiveness of face masks. Okay, so wear the face masks where you really need to, indoors, crowded, can't keep your distance, wear them then, but other than that, insisting on face masks might actually be dangerous. Now, of course, I believe that wearing face masks can't hurt if you know that it is very far from being great protection, if you know it's not a substitute for doing anything else. But I am not hearing that message very loudly at all. And I think people are indeed being lulled into a false and potentially deadly sense of security. Worse is the Victorian Premier recommending makeshift masks of potentially little value at all.
There can be a handkerchief, a scarf, a bandana. There's all manner of quite innovative methods. They're all over the internet.
Just the bandana? Well, let me be clear. Again, if you wear a mask and still take all the protections that you did without one, it may reduce a little your risk of spreading the virus. That's the main thing masks do. Stop you spreading the virus. It's not that much help in stopping you from getting it. But all of this is actually secondary to the most vital things that our governments should be doing to stop the worst thing about this epidemic. We're talking about these masks. Let's talk about what really stops the most important thing, the worst thing about this epidemic, which is people dying. And on that ground, I'm afraid that we again see the Victorian government especially being very tough on things that don't make much difference and very slack on what very much does. 1, keep sick people in strict quarantine. Well, the government notoriously failed there. I won't go into it again. 2, you keep the most vulnerable people, the ones most at risk of dying, as safe as you possibly can, and there we see another fail. 12 people have now died in Victoria's second wave of infections, 4 in their 90s, 7 in their 80s, and just 1, the youngest, in his 70s. Now, it's true that younger people can also die, but overwhelmingly they recover. It's the old that die, the very old in particular, and 1/3 of our dead died in nursing homes. Yet in Victoria, it wasn't until last week that face masks were made compulsory even there, in nursing homes. And it's not until now that Victoria is thinking of ways to stop nursing home staff from working across several nursing homes at once, which is guaranteed to help the virus spread, nursing home to nursing home. And it's not only now that Victoria is cracking down hard on visitors to nursing homes. Now, all of this is such basic stuff, so much more important than face masks. And only now it's being done. Not even, or they're talking about doing it. And it's all too late. Some 40 nursing homes in Melbourne and across the state now have reported coronavirus infections. And the old people who are getting these infections are quite likely to die. Deaths in Victoria will rise. 31 people are now in intensive care. This is so the story of the Victorian government in this virus crisis. It's catastrophic bungling. Very tough on controls on the young and the healthy, very weak on controls on the sick and the vulnerable. I find this so hard to take. The lost lives, the devastated economy, the people who have lost their jobs, and now these face masks, the symbol of the state's stupidity and its refusal to speak the truth.